Good afternoon, everyone, and thank you so much for joining us today for our live video. We are live today talking all about rare diseases because February is Rare Disease Awareness Month. So, my name is Gabby, and I will be your host today, and I'm here with Dr. Lula to talk more about rare diseases and the Rare Disease Clinic here at Boys Town. Dr. Lula, how are you doing today?
I'm doing very well, Gabby. Thank you so much for having me here today.
Awesome. It's great to have you. We did an interview with Dr. Lula a couple years ago when our rare disease clinic opened. So I'll make sure to link that in the comments below. But it will be great to have an update on all the good things happening at the clinic as well as spread awareness for rare disease. So if you are watching live during this presentation and you have a question for him, go ahead and drop it in the comments section of this video. Make sure you give it a like and a thumbs up. And if you're watching later on, maybe after this live video has concluded and you have a remaining question, you can always message our page directly and I'm happy to pass it along to him and get you the answer you are looking for. So let's hop right in. Kicking it off, what is a rare disease?
Yes, that question comes up very often. So, the definition of rare disease varies worldwide, but in the United States, a disease is considered rare if it affects less than 1 in 200,000 people or less than 1 in 1,500 people.
Wow. Yeah,
Yeah,
I would say that is rare.
yeah.
So, how many people worldwide live with a rare disease?
Yes, actually, it's people will be surprised, but it's a big number. So 300 million people worldwide, according to the current statistics, are affected with rare diseases. And if we just look at the United States, it's 30 million Americans are affected with rare diseases. So if we look at the census, it's looking like 1 in every 15 American is affected by a rare disease. So it's more common than we actually know of.
Definitely.
Yeah.
What kinds of rare diseases does the Boys Town Rare Disease Clinic care for?
Yes, so we are highly focused on the rare diseases pertaining to the brain and the rest of the nervous system. So we call it the neurogenetics and rare disease program over here. So we see a wide variety of different rare diseases. We get referrals for brain malformations. That means the brain just developing structurally different. So these kids often, when they get an MRI for developmental delay and a certain type of malformation is seen, they get referred to us. We get referral for rare epilepsy syndromes, trying to work up from the genetic standpoint. We get referrals for other types of rare diseases called leukodystrophies, which is a defect in the white matter development of the brain. Lysosomal storage disorders is another form of rare disease, like Pompe disease. Neuromuscular disease is a big chunk amongst that. So we see a lot of those cases as well. So we see a wide variety of different rare diseases pertaining to the brain itself, the spine, and the rest of the nervous system.
Mhm. And that's really special to point out, especially, in Omaha, Nebraska, right in the middle of the United States, that we have this clinic that can serve all these different rare diseases. I just want to highlight that.
Absolutely, absolutely. The goal is to really make Omaha the hub for the rare disease care in the Midwest. So I find it very special.
Mhm. Yeah, that kind of leads me to my next question. What made you interested and passionate about rare diseases? And maybe with that, if you want to give a little bit of background on your role and the different parts that you do at Boys Town, that would be great to hear about.
Absolutely, absolutely. Um, Taking care of children with a potential rare disease or known rare diseases is something always been special to my heart. And the roots came back from my training time back in Michigan, where as a resident I took care of a lot of patients, especially undiagnosed rare diseases, because the presentation can be very subtle to begin with. A lot of these families, on an average, are waiting for 4 to 5 hours. That's like a long diagnostic journey for them, and the amount of physical, emotional, economical burden that it puts on these families is very high. So that really touched me and made me go into the rare disease aspect, but also the curiosity of the unknown and trying to diagnose that is something rare. That's something I've always been interested in. and my mentor from Michigan, Dr. Sivaswamy, and my mentor in neurogenetics program in New York, Dr. Heather Lau, they really motivated me to be open to taking care of a lot of different varieties of rare diseases. So that's how, when I moved to Nebraska, I saw that this is already a very underserved area. And to top it off, we do have a big amount of children over here with known rare or undiagnosed rare diseases. So that really got me motivated to build something from the scratch over here. And that's how it all started in 2021. So we started our neurogenetics and rare disease clinic 3 years ago at Boys Town. It's been running really well. And then an amazing extension to that, Dr. Herman joined last year. So she also holds the rare disease clinic on Thursdays. And we have built an amazing team right now. So I've enough, a lot of good things to talk about the clinic.
Yes. Well, we are very blessed to have you on our team and are very grateful for all the ways that you are serving these families. So thanks for sharing that. So you mentioned a little bit in your response of the last question about diagnosing rare diseases. Can you talk a little bit more about how that goes? Do a lot of patients go to several different doctors before they're able to get diagnosed or come see you at the clinic? How does that work?
Yes, yes. Like I said, the average diagnostic time can be very long for a lot of our families. So you know they initially end up seeing a lot of different specialties. Sometimes it all starts with any issues in the gut, difficulty gaining weight, difficulty with feeding. So initially they may get a GI evaluation, and then they may get referred to neurology, because the brain controls everything. So we just have to make that connection. But yes, a lot of our patients do end up seeing a lot of different specialties, and then may get routed towards neurology, versus if they have a very clear neurologic presentation like seizures or motor delay or other aspects of developmental delay, we do get referrals then directly from the pediatricians or the patient's physical occupational therapist. And sometimes families do make a self referral to, when they are very concerned about their child. They're looking for answers. There's a lot of unknowns there, and they've been searching for answers for a long time, and they themselves suspect that there's something more going on, maybe from a genetic standpoint. So we just get referrals from different sources. So diagnosis can be very difficult, because the presentation can be very, very subtle initially. Not all patients may present with all the highlighting signs of rare genetic diseases. Some of them can be very, very subtle. So it's very important to zoom out of the camera, and look at the whole body, not just the brain. If the suspicion is there, try to think of other body systems, with the eyes, with hearing, with the heart, the kidneys, and anything else that will help us to fit the pieces of the puzzle together.
Mhm. Yeah. How does the Boys Town Rare Disease Clinic stand out in Omaha, and what makes us unique?
Yes, I think what really makes us unique is the people that are within our rare disease program. So just wanted to highlight all of our folks involved in the rare disease program. So I mentioned Dr. Isabella Herman, who's our other neurogenetics and rare disease specialist, and she does our clinics every Thursdays. She's highly involved in our rare disease program, and also very, very interested in the research aspects too. She's also involved in the newborn advisory program in the state of Nebraska. I'm very, very happy to collaborate our care with her. And then some of our other very special folks, Michaela, who's our neurogenetic case manager. She's really the binding person here, keeping us connected with our patients, and their other providers, coordinating a lot of care for our rare disease patients. And she's been amazing in making sure that everybody is in the loop, and all the loose ends are tied. So cannot talk enough good things about her. Carissa, she's a neurogenetics pharmacist. She's amazing, involved in a lot of these complicated therapeutics that we bring to Boys Town, for example, enzyme infusion therapies, other types of infusions or rare medications. She's so highly involved in making sure that we get the medications, dose it appropriately, and just monitoring from the safety standpoint. And then we have our other case managers like Heather, who's highly involved in our autism aspects, and Dr. Manusek, she is our pediatric neuropsychologist, who is also highly involved. A lot of our patients do need neuropsychology evaluation, so she's highly involved there. Farah, she's a very special person. She's our neurogenetics genetic counselor. So she's very important person in the team because she's the one who is doing genetic counseling for a lot of our patients. When we order a genetic test, when we are suspecting a potential rare disease, and we want to order a genetic test, she is the one who helps us and kind of decide what would be the ideal genetic test, and then counsels the families what genetic test means, what genetics means in general, what are the implications of those test results. And then when the test results are back, it's very hard for families, to sit down and listen to a devastating diagnosis. So she
Yeah.
does a great job in, helping them understand and break the complicated medical terminologies into simple terms and help them understand their child's genetic condition. So she's a very vital part of our team. So I think it takes a village to heal a child. I always say that. So but what makes us special is all these people within our team, and how we coordinate care for our patients, and are also emotionally available for them, is what makes Boys Town very special.
Mhm. Yeah, and I was gonna say the same thing. When you come to Boys Town for any medical need, whether it's rare diseases or anything else, is you really get that holistic care. So we're not just looking at one part of the body or one diagnosis. Where we're gonna look at the mental health, the physical health, and everything in between. So I'm really glad you could highlight those positions and give everyone a shout out, because the whole clinic is greatly appreciated. Okay, so the next question is, I think it would be cool to know, since we opened the clinic in 2021, ballpark about how many patients and families have we served through the rare disease clinic?
Yes, yes, it's a big number. I, of course, don't have an exact number, but on an average, myself and Dr. Herman, we get, overall 5 to 10 referrals a week, and sometimes more. If you look at the 3-year number, then it comes down to almost 1,000 patient referrals. And I'm talking about not necessarily just known genetic cases, but just like patients just coming to look for an answer for a potential rare condition or undiagnosed rare diseases. Yeah.
Mhm. Yeah, that's amazing. In just 3 short years, almost 1,000 is great. So I'm glad you could share that. Awesome. So we've talked a little bit about the referral process, but how does that work? Do most families go through their pediatrician first, or how can they get seen at the clinic?
Yes, so referrals come from different sources. Pediatrician is one of the most common source there. As we are raising awareness like this, on the Rare Disease Month, we are also trying to educate our community, our pediatricians, other providers about rare diseases. I think we're raising more and more awareness about what rare diseases are, how to identify them, how to identify a potential neurologic rare disease. So because of that, a lot of referrals do come through the pediatricians, the physical occupational speech pathologist for the patients, and sometimes patients also make a self referral if they are concerned. But typically, yes, it has to come through one of their providers, and we have a clinic line number that they can reach out to us, and that gets routed to our two schedulers that are dedicated to neurology department, and then they call the families back to help schedule. And sometimes we get a fax referral from the pediatricians, and with the number to call the family, and that's how we are able to reach out to them to help schedule the appointments.
Awesome. And I do have linked above this video the website to go to get all of that information on the clinic. So you can head there after this video concludes to see all that. So during Rare Disease Month, Dr. Lula, I wanted to ask you, what do you think the average person who maybe isn't involved in rare disease care should know about this awareness month and about these diseases?
Yes, yes. I think it's very important to know, like we previously discussed, I mean, 300 million worldwide, just 30 million in the United States. It's a big number. Um, there are still many diseases, rare, undiagnosed, that exist that we don't know of. Um, so one very important aspect, and this is a lot for the parents as well, is to keep advocating for their child. If they are suspecting there's something wrong with their child, there's something more going on with their child, yeah, more than just the brain. um, they're concerned about something, they should always reach out to their pediatrician, or sometimes they even reach out directly to us to inquire about a potential referral. So just advocacy is very important to know that we are here, we are very interested in taking care of our rare disease community, and we want to completely support them. So that is very important. I also encourage parents to always be also involved locally with their legislation, because a lot of the funding can come from the government, the legislation to help build something for a rare disease that may not have been available. So that's also very very important. So this is a big message that I give, is that keep advocating for your child, and if you feel something doesn't make sense, um, there's no harm in getting checked out, getting a referral, and we go from there.
Yeah, no concern is too small when it comes to your kids. So
Yes.
definitely. Awesome. Okay, so I just have two more questions here for Dr. Lula. So if you're watching live and you have a question for him, now is the time to drop it in the comment section, and make sure you give this video a thumbs up. Okay, so how can we support those with rare diseases and their families?
Yes. Again, very special for me, because we have established this program here at Boys Town. We have our case managers, our nurses, social workers, neuropharmacists, and our neurologist here. Um, I want our patients and families to know that we're not only here to treat the symptoms. We want to be available to the families, as a support system. And I personally believe a lot in healing, and that's how I have been trained as well. That knowing that there's no cure for many rare diseases. I mean, statistics say that for 95% of rare diseases, there is unfortunately no cure, or even treatments. So when there is no cure, I think we should all believe in healing process, and that's very important. And that goes beyond treating with a medication, and it is being with our families, being a hope for them, showing some hope for the future, because there's a lot that we have to attain in the future with respect to rare disease. We are highly involved. We want to also open up clinical trials here at Boys Town, and that is one big hope in the area of genetics and rare diseases, is to be able to find new treatments or potential treatments for our families. So even though yes, we know that there is no treatment available now, but we still want to have hope for the future. And I want to promise the families that we are there with them emotionally, um, and from that healing perspective, that is so important for them to know, because I feel that once you have that hope of positivity, um, improvements do happen. That's very important in continuation of care for a lot of these patients, knowing that there is no cure, but there is possibility of healing. So that is very important.
Mm. Yes, and healing and hope are two pinnacles at Boys Town that we always try to encourage. So I'm glad you could tie that in.
And outside of that, of course, in addition to being involved in the clinical world and the research world, we are also advocates for our patients. So we ourselves, do touch base with legislation if we want to advocate about, you know, including a potential treatment, or a potential disease condition that we want to involve in newborn screening. Like Dr. Herman is involved in the newborn screening program. We love to do talks like these to raise awareness. So that is very important aspect, education to bring new prospective trainees or doctors and other providers who could be interested in rare diseases, because we want to first train more people who are interested and provide care for the rare diseases. So that's so very important. And the other aspect is, there are rare diseases that every rare disease doctor also may have never seen.
Yeah.
I just recently saw a case where only 30 cases have been known in the entire world. So
Wow.
imagine how rare that is. So, and that was the first for me. So always important that as a rare disease provider, it's important to connect them to other physicians who may have experience with that potential rare diseases. So my goal is also to build up an excellent team through the US. If there's a different rare disease specialist that has some experience with that condition, I will refer my patient and them for an opinion. And so it's creating a network and the best possible team for our patients. And that's how, we keep supporting our families.
Yes, it takes a village, especially when it comes to rare diseases. I mean, we talked about they're rare, but there's also so many people that have them. But then when you break up the branch of all the different rare diseases that exist, it's great what
Yes.
you said about working together. So I appreciate that. Well, if you are watching and you're looking for a way to spread awareness of rare diseases during this awareness month of February, you can share this video. That's a great way to spread the word, spread Dr. Lulla's knowledge and expertise on the subject, and hopefully we can get this in front of more people so we can all spread awareness and support patients and families who are diagnosed with rare diseases or are looking for a diagnosis. So thank you so much for your time today. I know you're so busy with clinic and everything, so we appreciate you taking the time to talk to us live about this.
No, thank you. Thank you so much, Gabby, for allowing me to advocate for our rare disease community. As always, I'm grateful.
You're very welcome. Thank you all so much for watching. Make sure you like this video and go ahead and tune into the next one. So thank you so much and have a great day.